Back in 2009, my grandpa passed away, and I had come home for the funeral, and we were sitting in a room with my grandma on my other side of the family. My entire family was there, and my grandma was just recovering from her second heart surgery. She already had 2 spinal surgeries, recovering from her second heart surgery. Confined to a walker or wheelchair or a cane when she was feeling really good, and mostly confined to the 4 walls of her home. If she wasn't there, she was likely going to the hospital for some sort of appointment, some sort of complication. And she had just grabbed a glass of water, and she came and she brought her wheeled walker back over and sat down, and you could see she was just exhausted. And I said, Grandma, you doing okay? And she says, you know what, Steve? She said, if there was one thing I would have done differently, if I could, it would have been to take care of myself before it was too late. My entire family is around there, and it kind of got silent in the room. And her next statement changed my career forever. I wish I wouldn't have lived past my first heart surgery. You could have heard a pin drop in the room. And I realized that day what my intention and my mission was for my career. It was to help people before they ever got to that point where they're regretting not taking better care of themselves before it was too late. I really want you to engage, right? And the intent of this class is to help you guys to understand, number one, I want to push you, right? I want to get you to change if it's needed, right? To change your paradigm away from a sickness and disease paradigm or a viewpoint of the world into one where we believe that our bodies can heal themselves and that God put in us the ability to heal ourselves. We just have to give it what it needs to get there, because that's what I truly believe that to be the case with our world today. So I'm going to ask you to put away your cell phones, right? If you're watching this on your cell phone, cut out the different distractions, stay off of social media just for an hour. Give it the time it needs. Grab a drink, grab a loved one, watch it with a loved one, because obviously we're going to be asking you to make changes in your lifestyle. And so it's important that you have your loved ones, that they know what you're doing and know what you're going through, okay? So I want to invite you to do that as well. So buckle up, and here we go. When we look at chronic health or chronic disease in America today, I think we can all agree that what we're doing isn't working. Every year, the cost of healthcare goes up. Every year, the amount of chronic disease continues to climb. We spend more time, energy, and money being sick every year than ever have before. And so at some point, we have to ask, are we going down the right road? Are we doing the right thing? Okay. And so I think it's gonna be evident tonight is that it's not necessarily your medical doctor's fault or anything like that. They're just trained differently. They're not trained to address the underlying triggers of disease. And I'm going to get a lot more into that as we go. What I want to promise you tonight is that if you take action and you do what we ask you to do, I promise you in a year, 2 years, 5 years, that your life will be measurably healthier, right? That you'll be getting more. And statistically, the research shows that if we include preventative health and teach people how to get healthy and stay healthy, that you spend less on healthcare, right? You get more quality of life. You get more out of your day. You're happier. You simply like life a lot more. So my promise, again, is if you do what we ask you to do, things will be better. My own story, I do have my own miracle story. I grew up small town North Dakota. I grew up on a farm boy. I was a farm boy, and I dealt with severe asthma, severe allergies, all sorts of different seasonal type allergies, right? And what I didn't know is that the things I was putting into my body and problems in my neck are what were causing a lot of these asthma and allergies. And so what happened was, even though on the outside, I was an athlete, I was active in sports, on the inside, right, I was a sick kid, right? I was always the first kid to have to leave because the pollen was plugging me up and causing all sorts of different problems. I couldn't help out on the farm like I'd wanted to, and I felt almost like I was handicapped, even though again on the outside I didn't have those handicaps. And so what happened was, in always wanting to help people, I went to nursing school, I got a nursing degree, and I started working in the ICU down in Sioux Falls, South Dakota. During that time, what I realized was that even in that initial year, right, what I realized is that the healthcare system isn't built to create healthy people. It's built to save people in a time of crisis, and that's what it's good at. And at that time, I met a chiropractor. I started to get adjusted, right? He talked about some concepts of chiropractic, how the body is designed to heal itself, and how the nerve system, the brain, the spinal cord, control and coordinate all healing and all function of the human body. And it made perfect sense to me, right? But I didn't link that to my asthma and my allergies. And so what happens is I was curious enough to start getting adjusted because I had some musculoskeletal complaints. But more importantly, my asthma and my allergies got like 80% better. So I started asking questions in the hospital system to the doctors, to the nurses. Most of the nurses were extremely supportive of chiropractic. The doctors, however, not so supportive. I got a lot of kickback, a lot of dogma. And when they started to cut down an entire profession with clearly not knowing anything about it, that's when I knew that there was something to this chiropractic thing. And so next thing you know, right, fast forward about 6 months and I'm in chiropractic school. I start chiropractic school. I learned a ton, but there was things that didn't make sense, right? And so we talked a lot about the health of the nervous system and how chiropractic can support that. But we didn't really talk about the other causes of diseases, right? The other triggers, right? The foods we put into our body and how we move, how we exercise, our stress, our mental health. And so when we start to look into that, and I did a post-grad certification through the International Chiropractic Association in Wellness Sciences. I got my post-grad certificate, and that course changed my entire perspective on healthcare in general. And then it was shortly after that I'd come back for that funeral and then saw my grandma so sick and realized what I was put on this earth to do. I came across a metabolic recovery and weight loss program through a colleague of mine, and it was 100% whole food based, which I was all about that. I didn't want packaged pills, lotions, potions, anything like that. I wanted the people to get nutrition through their foods. And what we realized when we started that was not only did people lose weight, but there are different immune system problems, right? The rheumatoid arthritis would have people that had rheumatoid arthritis that would go into remission, right? Diabetes, people would reverse their insulin resistance and reverse their diabetes, get off their medications, their blood pressure would come down. There was all these different miracles that were happening, but I didn't have the opportunity to measure it and see what was happening with these people. And I also realized that there was a whole world of people that didn't need to lose weight, but had lost their health, and that the foods that they were putting in their body were affecting everything about them. And so we brought in some testing, and we came across some groups that were doing a lot of advanced lab testing where we talk about getting complete lab testing. We're going to talk about some of that tonight. However, what I realized was that once we started to be able to test, it was like taking my handcuffs off, because we could actually test if they had digestive issues. We could check essentially what's going on in their digestive system so we could fix it. Food allergies, figuring out triggers. For me, that was a huge thing, because even though I was massively healthier, I was eating super clean, a paleo, keto diet, no sugar, none of that stuff, I would still develop a lot of fatigue during the day. In fact, to the point where I felt like I needed a nap like 5 days a week. And so what happened was when I did my own food allergy testing, I found out that I was allergic to eggs. One of the big things that I was allergic to was eggs. And I realized I was eating eggs like 5 days a week. I would run home for lunch, eat some eggs, get back to the office. And by the time I got back to the office, I felt like I needed a nap, right? And I needed like a gallon of coffee just to get through the day. As soon as I cut them out, it was like a night and day difference in my energy levels. And then the naps are actually super rare at this point. And they're more so when I choose to do it, not when I feel like I need it or have to do it. There is, a world of different things. Turned out I had a problem with producing thyroid hormone. I wasn't getting the right nutrients to produce my own thyroid hormone. And so I got on, basically started taking the nutrition for that too, which made a marked difference in my energy levels further. I had my own miracle, had my own stories and how we got to here. And so I want to cover a little bit tonight. The first thing I want to get into is I referred to it a little bit earlier, is introducing a different paradigm, okay? A paradigm is the lens through which we see the world, right? And particularly revolving around our health. Do we think that bad genes, bad germs, and bad luck are what determines whether or not we get sick or we stay well? Or do we believe that that God made us to be self-healing, self-regulating organisms, and that if we're not able to do that, and if we're having symptoms, it's a sign that there's something not right in the human body? And so that's part of what I want to go through tonight is, again, I want to make you feel a little bit uncomfortable. If you're feeling uncomfortable, I want you to lean into that, right? Because what that means is maybe your paradigm is being challenged just a little bit, or maybe you're like, you know what? I've been thinking that, especially the last 3 years, last 4 years, last 5 years with all the COVID stuff happening and all the weird stuff happening, and actually starting to have this awakening where we're realizing that our healthcare system isn't built to make us healthy. It's just built to treat symptoms and keep us alive a little bit longer while we go back to our everyday life. In order for me to help you change that paradigm, I need to help you to recognize that the paradigm that most of our America's healthcare system is built upon is a faulty paradigm that's destined to fail. Okay. And I want to use an analogy. I think it's a really great analogy. And I want to picture the human body. I want you to think about it like a house, right? A house that has a fire in it, right? If there's a problem or a disease happening, I want you to think about that like a fire. Okay. If there's a fire in your house, who do you call? Well, obviously the firefighters. You want the firefighters there. And so I think of the firefighters like a medical doctor or the medical model of healthcare, where if you have a fire in your house, an emergency, that's what medicine is great for. It's great for helping with crisis care. And so when we have a fire in our house, right, don't call a carpenter, don't call a general contractor. That's like me, right? That's like the wellness practitioners, right? The doctor of cause is what we say, right? Don't call us when your body's in crisis, right? That's what medicine's good at. That's what they're good at, saving lives in a time of crisis, okay? But I want you to think about the ramifications of calling the fire department when you have a fire in your house. So let's say everybody's out of the house. You know, we save the dogs, we save the animals, and so everybody's out, everybody's safe, and the fire is put out with the axes, their fire hoses, right? So they get out their axes, get out their fire hoses and put things out. But there's collateral damage there, right? The walls are rotted, right? The carpet's burned. The whole thing is going to need to be remodeled if it can be preserved at all. That's where when we look at what we call a perspective, right? A different perspective about healthcare, the firefighters are looking at the event, right? And saying, hey, we did a great job. And I'm not saying they didn't, right? They saved the family. Everybody's safe. However, when the general contractor, the carpenters get there, what's their perspective of the house, right? Holy smokes, this is a mess. We have a lot of work to do. We have the kitchen that needs help. We have the living room that needs help. Shoot, we even got the garage. The garage even needs some help. So we have all these different areas that need to be built, rebuilt, and repaired. So here's what happens in the healthcare world today. Instead of repairing it, they allow the firefighters to continue to pour water, use their axes and fire hoses, and just pour water on that house. They say, you know what, you had a fire in here at one point. You're going to need to pour water on this house indefinitely. Well, what happens if we were just to do that and use that as the primary form of repairing our house? Number one, it's not going to get any better, right? You're not going to restore that house to its original form. But then number two, it's literally going to rot from the inside out. And you'll see that with a lot of different medications, a lot of different approaches where essentially, yes, it may keep you alive for the short term, but over time, the side effects of these medications become more and more, and they actually create more problems in the human body as you go through life. So our intention as a carpenter is to fix that house, to fix it right so that it can function like it should. Just like I think it'd be silly to call a carpenter when your house is on fire, right? I think it's just as silly to call a firefighter to rebuild your house, right? So when you look at that like the human body, I think it's just as silly to think that drugs and surgeries can repair a house and return it, or can repair a human body and return it to its original form and help to maintain it and maintain that at the health of your body, right? Your body, mind, and your spirit. Whereas when we look at taking a carpenter approach, our intention is to build resilient, strong bodies, right? Resiliency meaning when we're faced with challenges, when we're faced with a new virus or a new bacteria, right? How prepared is your body to handle that, right? If we're faced with a fall off a ladder, how prepared is it, right? If we're faced with these different challenges, how well is your body able to hold up and withstand, right? And we see that a lot where our resiliency and our adaptability has been depleted, right? Because we've taken too many withdrawals from our health savings account or our health banking account and not enough deposits. If we would think about our health like we do about our financial health, we would know that we shouldn't wait until we're bankrupt to actually start to invest in our health, right? The best time to invest in our health is while we still have it, right? And if we have lost it and we're showing different signs and symptoms of that health deteriorating, those are warning signals. Pain is a warning sign that something's not right and we need to address the underlying reasons, not just put tape over an engine light, right? Not just cover up the pain with a pill, lotion, or potion, right? That we actually address the reason why, whether it's inflammation being created in the body, whether there's structural problems in the spine or in the body or the knee, right? Whether the nerves are breaking down in your body, whether the blood, your cardiovascular health is deteriorating, right? What do we need to do, right? If we're developing hormonal problems, right? We need to get those hormones tested in a way that's actually complete so that we know what we're doing. I'm gonna get into that a little bit more as we go here. So when we think about this, maybe put it into action in an analogy, right? We think about high blood pressure, something as simple and common as high blood pressure, right? The medical or allopathic approach says, hey, you have some high blood pressure. We need to give you medication to bring that down. They're not wrong, right? Blood pressure medication will lower blood pressure. But I ask you this, is it addressing the underlying reason why blood pressure is high? Right? Maybe we're stressed out every day and our blood pressure is high. Maybe we're eating inflammatory food that's driving blood pressure up. Think of it this way, right? Your toe can control your heart, right? If I were to take and have you come over to my house and step on your toe and take your blood pressure, right? I'd take your blood pressure, right? And then I would step on your toe like hard, and we would take your blood pressure again, your blood pressure would go up, right? And so is the solution to that to use medication to lower your blood pressure, or is a solution to take my stinking foot off your foot, right? So that the pain goes away, so your blood pressure comes down. And so this is the mindset I want you to start thinking about, because again, those medications can keep you alive for the short term, but there are long-term implications. In fact, the number one side effect of blood pressure medication is chronic fatigue. How common is chronic fatigue today, right? For men, the second most common one, sexual dysfunction. Because if you're artificially lowering your blood pressure, you can't get blood flow to those areas that need blood flow in order to perform. Now, the next thing, right, when we talk about an alternative medicine, many alternative medicine practitioners, or the solutions you see on TikTok, Twitter, on Instagram, all these places, they'll say, hey, well, let's give you some B12, or let's give you some fish oil, like to lower your blood pressure, right? And not that those are bad things, but the question that I would have is, how do you know that those supplements are actually addressing the underlying problem? Number one. Number two, there are thousands of different solutions, and people, we see it all the time with things like sleep or whatever happens to be, of people trialing different supplements, and maybe they work for a while, but then at some point they always stop working or stop helping. But if we could test the body, figure out why, address underlying triggers, and teach you to live a lifestyle where you're getting those nutrients that you need over time, right? We don't expect you to be able to change everything immediately or even be perfect, right? I got plenty of examples where people are not perfect at all, but we're still able to help them because they're doing enough to move their bodies from the state of sickness. They're doing enough to move them to a state of health again. And then we just need to teach you how to stay there. We have to do things long enough and consistent enough. If you've had a problem that's been there for 30 years, right? And you're at if we have 0% health, which is death, 100% health, which is optimal health, right? And somewhere in the middle is where symptoms start, right? But if you're over here, it's going to take time and consistency, especially if that's been there for 40, 50 years, or you had a major onslaught of different stressors or different traumas. It's going to take some time and consistency to allow that body to heal, right? Tissue takes time to heal to get you to over here where you're stable and you're healthy. And that's when we start to talk about, hey, like, what do we do just to keep you there then? So our approach is where we want to get good, thorough testing. We want to start to look at the different triggers why people get sick in the first place, okay? Whether it's blood testing, maybe it's some what we call Dutch testing, where we're actually taking a urine test to look at the different types of hormones and how they're moving through the body, right? There's blood hormones and there's urine hormones, and the only way to get a full test is to do both of them. Looking at the microbiome or the digestive tract to make sure that you're producing the right chemicals to break food down, checking for inflammatory levels, looking at the good bacteria, the bad bacteria, and do we have a good healthy ecosystem? And that also allows us to follow up and post-test to make sure that the choices and the changes that we're helping people to make are actually being effective. Okay, so that's when we talk about the approach of getting to the underlying causes, right? A part of that is making sure that the health of your spine and your nervous system is healthy, right? That's a big deal, and it's often an overlooked place that most practitioners, functional medicine, and mainstream medicine overlook, is the actual entire system that coordinates. They look in the blood, but they don't look in the nervous system, which is the master coordinator of everything. The research shows unequivocally, if you have a problem in the nervous system or the nerve system, you also have a problem with the endocrine system, and you have a problem with the immune system, okay? It's called the neuroendocrine immune system, right? So our job, again, is to be those carpenters, right, over time to help you to know, to lead you back to health, to slow, stop, and if we can, reverse that chronic disease. I want to give a great example. Little Annabelle, one of probably the most impactful patients I've ever had. I started taking care of her when she was roughly around 1 or 2 years old. And I remember her mom saying that pretty much Every month they were in the hospital where she was admitted with RSV, ear infections. She went from antibiotics, back and forth from antibiotics to steroids, this, that, and the other, right? Chronic ear infections, poor sleep, extreme irritability and extreme colic, chronic constipation, a very short temper, right? Emotional breakdowns, extreme emotional breakdowns. Mom came to me. She didn't even know she had no idea what to do. She's like, take her. I don't know what to do with her. We start taking care of her. And within about a month, there was marked differences in her emotions, marked differences in her digestion, and then her immune system started to repair. After her first adjustment in her office, she had actually never been in the hospital admitted again. Okay, she had one round of antibiotics like 2 weeks into care, but again, we were just getting started at that point. The reason this story is so important to me and so impactful is that this family, they moved to a different city, and so I kept in like general touch with them, but I wasn't able to keep seeing them for care in our office. So 7 years later, her mom has another baby, and she had it in Bismarck. And so she called me up and she said, hey, I'd like for you to check my newborn because I'm in town. I'd love to see you again. I want you to see Annabelle because it had been 7 years since I'd seen her. And during that conversation was another one of those impactful moments of my life. And what she said to me, she said, you know what, Dr. Steve? She said, I want you to tell Annabelle's story. And I said, well, like, tell me more. She said that I look around my friends and they have all these different autistic children and they have all these learning disorders and all these different health problems around multiple different medications. And she said, we decided to make a change when we came to see you, that we had no other choice. And what I realized was that put Annabelle's entire life onto a different road or a different path. And she said, now I have this girl that's mature. She's at the top of her class in learning. She's active in sports. She has all sorts of friends because all of the emotional stuff has been resolved where she's able to control those emotions because we got her back to health, right? Through changing her food, changing her nutrition, correcting that nerve interference. And I think that's important for everybody when we think about choosing a different path. And each choice that we make along that way is cumulative, meaning we go down this path and then we keep going that way, right? Those little choices take us further and further in one direction versus, hey, we made a pivotal point. We're going to move this direction and we're going to keep moving that direction. And so my hope is that we can make a pivotal point for you if that's needed. Maybe we just need to redirect some of this stuff and figure out some answers, and you're already on this path to where we start to make some changes. We get you some breakthroughs in your own health, but then you continue to learn and develop your own health and continue to get better instead of going back to where you came from before. And then I go forward and I think about what things could have looked like for Annabelle or a lot of these people that we see, especially the kids. Saul is another gentleman in our office, and again, another digestive system case where before he met us, he had 11 surgeries. He had Crohn's disease and 11 surgeries where they were cutting out pieces of his colon. It was getting continually shorter and shorter because the tissue was so inflamed that it was tearing open and it was literally wide open wounds and dying. That tissue was dying. We started with him, got things figured out, started getting him adjusted, started changing his foods, did some food allergy testing, did that stool testing to look at what's going on in his digestive tract. 3 years later now, I believe, basically his surgeries, obviously none of that at all. The chronic extreme diarrhea he dealt with every day is completely cleared up. He was on some extremely potent immune medications that they're called immune suppressants that suppress the immune response. He's been off all of that. Abdominal pain's gone. His colonoscopies have went from wide open wounds to completely healed. Lab markers for Crohn's, like calprotectin, has been markedly decreased into normal levels, which again is all stuff that we test. And the biggest thing, he had chronic anemia, meaning they couldn't, because of all the bleeding and all the problems in his digestive tract, his iron levels were so low that his energy levels were just on the floor. Well, today, those energy levels are normal and he's able to live a normal life. And so this is the end product. The reason I want to say that is it's never too late. This gentleman, it's not like he was a child, right? He had a lot of significant surgeries, a lot of things that had happened up to that point. So a lot of times people say, well, I've had this, and this, done already. Can you even help me at this point? And usually the answer is yes, right? We're willing, depending if you're willing to work at it and willing to do what we ask you to do, there is unlimited capabilities as to what the body is potentially capable of doing. We always say that there are limitations of matter, meaning if you've had an organ cut out, completely cut out, if your thyroid's been cut out, yes, you're going to need some sort of thyroid medication indefinitely, right? But again, even at that point, we can help. When we talk about, even Time magazine, 20 years ago, they talked about the secret killer being inflammation. And you guys, Inflammation, as well as I would say insulin resistance and liver health, are some of the three major things that create chronic disease. And when we look at what the medical approach is, it's just throwing pills at it, right? Albert Einstein says, insanity is doing the same thing over and over again and expecting a different result. And I have to start to question whether they have your best intentions in mind if all they're willing to do to address chronic disease is to come up with the next magic pill, potion, or lotion that's going to help you. So the question that we always ask, what is health, right? And we get a lot of different answers, different ideas. The absence of disease, right? Or not merely the absence of disease. Some people say, well, it's just feeling good. Well, I will say that measuring your health by how you feel is extremely dangerous. And the reason I say that is, we hear about the guy that goes out golfing and he feels great one day, plops over and dies from a heart attack the next. Well, he wasn't healthy the day before. He felt good, but he wasn't healthy, right? And so that's where the beauty of the testing is. It allows us to see what's going on within you and what direction your health is going so we can learn about where to move and where to help you. We think about, what do healthy people do, right? And so most common answers, they eat well, they exercise, they get good sleep, right? But we all know people that do all three of those things and they're still sick all the time, and vice versa. The different people that can generally feel good all the time, even though they don't eat well, right? And they say that's not fair, or they can eat whatever they want and not put on weight. Well, yes, those three things are all cornerstones of health, and we really want you to be looking at that, but it's the details that count. And I also talk about so much of our health world is built upon like theories and assumptions and things and just basically conditioned, right? That coffee, stuffy ache fever so you can rest medicine. We all know where that came from, right? Ask your doctor if this drug is right for you, right? Milk does a body good, right? Well, not all milks, and that's a whole nother conversation there. And then we talk about even like toothpaste, right? The most common ingredient is fluoride in toothpaste. Fluoride is a complete neurotoxin, but we're told you it's required to keep your teeth healthy, even though you read on it and it says, if you swallow this stuff, please call poison control, right? Salt being bad for you. So there's all these different social conditioning or conditioning to get us to believe things, to consume their pills. When we talk about Webster's dictionary, right? It defines health as a condition of wholeness to which all of the organs are functioning 100% of the time. I think that's a pretty darn good analogy. And notice what's missing. They don't say anything about how you're feeling that day. So the next thing I want to cover is I want to get into what causes dis-ease, okay? And so when we talk about this concept of dis-ease, Dr. Steve, why do you say disease like dis-ease, okay? Dis-ease meaning the body is no longer at ease and it's breaking down. So it's ease, no longer at ease, right? So dis-ease. When we look at three major conditions or three major buckets, right? Traumas, toxins, and thoughts, the three T's, okay? So I'm gonna dive into these. And so when we talk about this, right, what system, right, when we talk about the first one, physical stressors or traumas, how physically we move, or physical stressors like being sedentary, right, sitting around too much, and then different injuries. And these injuries specifically, we talk about the system that controls and coordinates every aspect of the human experience. That is the nervous system, right? The nervous system is a master control system of the human body. It controls every organ, cell, tissue, and function of the human body. Without it, each system would not exist, directly from Gray's medical textbooks. So remember Christopher Reeves, Superman, right? He had an injury, fell off a horse, had an injury to his neck, and ended up being paralyzed, ended up having to be on a respirator, right? Because his lungs didn't work. He didn't injure his lungs. He didn't injure his low back. He didn't injure his legs. He injured his spinal cord, which therefore controls and coordinates everything from there down. He actually died from bed sores because of the effect that trauma to his neck had on his immune system. So that nervous system trauma affected his immune system negatively and made it a lot harder for his body to heal. The most common place that these traumas occur is actually the birth process. Dr. Gutmann, who was a German medical doctor, through some research showed that essentially trauma to the neck during the childbirth affects 4 out of 5 children, and leading to everything from, at that age, colicky to spitting up to trouble sleeping at night to constipation. But if it was left uncorrected, as they became kids, as they got older, it developed into headaches, learning disorders, mood disorders, right? Troubles with behaviors, things like that, and immune system problems, right? Chronic ear infections. And then as that person ages, right, it becomes migraine headaches, it becomes chronic fatigue, it becomes all these other things, right? And so that's when we talk about two different paths and why we believe having kids checked is just as important, if not more important, than trying to help an adult when they've had 50, 60 years of degenerative changes already.
Oh, there you go, fella.
Come on, buddy.
All right.
Ears of a girl. Ears of a girl.
Make you cute for the camera.
Oh, yeah. Keep coming back. You did good.
There you go.
All right.
Look at those big old testicles, though. Bottom of a boy. Bottom of a boy.
Yeah.
Well, he sure had a big head here.
Yeah, that was the problem.
That trauma, right? So that's what we call a traumatic birth process. And could you imagine a child going through their entire life never having that trauma to that neck corrected? Forceps extractions, the list goes on where all these children, right, when we pull them out of the womb and things are torqued and twisted, there's countries that actually require, after a traumatic birth, that the person is referred to a chiropractor. I believe it's Denmark. But in America, it's completely different, where there's a lot of ignorance and prejudice against chiropractic, and you've probably actually been experienced or been heard some of that. A lot of misconceptions about what we do. Car accidents, right? Too much sitting at a desk, right? We look at this stuff that builds up over time, right? Computers, cell phones, right? There's a whole new term called text neck. Too heavy of backpacks, things like, there's all sorts of different. Sports injuries is a big place where things start coming, jobs where we drive, right? So too much sitting over time. So one of the things we always talk about is feeling over function. Again, your nervous system, you have three components to your nervous system. You have the motor that moves our muscles, that moves our body around, right? And then you have the autonomic that controls how our organs work, right? And then the third part is what we have called our sensory nerves, where we experience things like pain, heat, cold, all that sort of thing. The interesting thing is most people think about chiropractic as pain-based, right? Meaning if I'm hurting, I get adjusted. Here's the important part, okay? The important part to that is that less than 6% of your nervous system is built towards pain, okay? The rest is in actually how you're actually functioning. And so it's very dangerous to judge the health of your spine by whether you hurt or not, right? And so one of the things we love to do is what's called a motion x-ray, where we can see what's moving and what's not moving. So we can give you a good idea of essentially how things are functioning, not how you're feeling. Because as you can see in the video that's overlaid here, when things aren't moving, they break down, and you see that on that what's called a motion MRI. I wish we had that fancy technology, but we don't. We do motion x-rays. And so that's part of an initial visit. If we are working in the office with you, that we'll be looking at that. We talk about degenerative changes of the spine, right? We can't give you back what you've already lost. And so the sooner a person can get in and start addressing inflammation and start making sure that spine is healthy, the more the likelihood that we're going to be able to help you for the long term, okay? Don't wait. That's not a thing that you want to put off down the road. Next thing I want to get into, the next stressor or the next category is going to be the biochemical or chemical components, meaning the things that we expose our body to, that we put into our body, right? Foods, environmental things like things we put on our skin, lotions, and all that sort of thing. I'm going to take a kind of a sidetrack and get into what we call our Swiss watch principle, okay? Yes, we talk about the nervous system controlling and coordinating every aspect of the human experience. And I think many corrective care chiropractors do a good job of communicating that. However, I think what gets missed in that boat where everything gets put together is to understand that there are multiple systems in the human body, and they're all interconnected. Just like a watch, right? Where we have all these little gears on a watch, and if one of those gears gets off, it can set an entire thing off, like it can interfere with the entire system, and the watch may not even work at all, or it's gonna obviously just not function like it should. So this is how the body works. And so when we think about this, right, and this is where when we look at using a medication, very oftentimes it's only looking at one system, and it's at the expense of all these other systems. For example, maybe they'll tell you to take an aspirin a day, right, for heart health, like to thin your blood. But what they don't tell you is that that's going to affect those other systems as well. And for instance, right, it affects the digestive system, where it makes your intestinal lining extra thin and more prone to bleeding. what happens then is different foods we eat, right? We're much less likely to have that food completely broken down, and we end up absorbing things in through that digestive tract because it's not as healthy as what it should be, and we end up creating more inflammation and more problems. In fact, the American Heart Association has recently stated that the risks for most people of taking aspirin do not outweigh the benefits. Okay, and we see this all the time. Those long-term use of NSAIDs, there are a lot of implications for that. So what we want to do is we want to look at the different systems and help to move the entire Swiss watch in that right direction towards health, instead of just trying to manipulate one system to make your numbers or your lab look good while your health continues to deteriorate. I'm going to get right into this, right? The first thing I want to cover is hormones, right? When we think about hormones, right, there's like this big, huge topic, right? But when we look at hormones, specifically your steroid-based hormones, this is a good example of that Swiss watch, right? Cholesterol, specifically LDL, right, which is given the rap of being the bad one, is required for production of every steroid-based hormone in the human body. So for women, you think of your estrogen, right? And for men, you think of your testosterone, right? But again, it's a lot more complex than that. Also cortisol, which helps your body to deal with stress, and cortisone, which tends to help your body to help to heal and help to deal with inflammation. So I'm going to dive into more of that as we go. The important thing being is it's a great example of when we take a cholesterol medication that artificially lowers cholesterol, that's also going to affect the production of these different hormones. In fact, the research shows that cholesterol medication will measurably decrease testosterone levels in men. And we have an epidemic of low testosterone in our society today. In fact, I think they said one generation, I think I was reading, testosterone levels have dropped around 40%, which is massive when you think about that. I got more of that, and that's one of the things I really love is helping men to help to restore testosterone levels to normal levels. Our other practitioners, when we talk about hormone dysfunction with women, hormone depletion, hormone imbalances, right? Things like PCOS, things like thyroid disorders, that sort of thing. I'll take care of that sort of thing too, but we have different practitioners in the clinic that definitely are there to help out with abnormal hormones in women. And so as a few examples here, right? So without complete testing, we are literally guessing. When we're taught about estrogen, right? Well, most people don't know that estrogen isn't a hormone itself. Estrogen is a group of 7 different hormones, and each one of those have different functions and different effects on that human body. So to lump it all in together is very dangerous. And if you're starting to manipulate hormones without measuring these different things, it can be extremely dangerous for the patient and set you up for a lot of long-term problems. As an example, right? So this lady here, we use what's called Dutch testing, which is a urine test to check how the body's going through the different, we call the technical term is metabolizing, how things are being processed out of the body, how those different hormones are being processed out of the body. But chronic fatigue, irregular cycle, cramps, weight gain since her last childbirth. So this is a woman of childbearing years, even though she had made some changes, cleaned things up. But if you look in through right this middle area here where we see these dials really high in the red, specifically there's an area here that says that basically it's a pathway that's very DNA damaging. And when we talk about estrogen-based cancers, this lady could very well have been prone to getting breast cancer later in life. And we knew that because of doing this testing, but it also helped us to know where we need to help this lady, right? We needed to help her liver to actually move those estrogens out of the body because there was too much of these different estrogens building up in her system, and that the body wasn't able to process them out appropriately. So once we got the liver cleaned up, got her moving in the right direction, things got a lot better for her. So the question that I have is how many women, right, go through their entire lives without having adequate hormone testing done? How many men, right? Even I would say 4 out of 5 men that we test, even under the age of 30, have low testosterone. And the cool thing is if we can fix these different things, fix the insulin resistance, fix their liver, get them off the different things creating inflammation and get their blood flow and circulation healthy again, most of these people regain and recover their testosterone levels on their own. For women, right? There's different ways that we can clean up these different pathways to help what God put in us, to help those pathways to function like they're normally supposed to, and then to support the stress cycles and things like that, because stress plays a huge impact on women's hormones as well. When we look at our hormone chart, if you look at kind of like a river, right, like a fork in the river, when we look at all these other estrogen, all these other hormones being produced, if we have a ton of stress or a ton of inflammation, or most people have both, right? it's going to start to pull those different hormones, the ability to produce those hormones down through those pathways to create cortisol and cortisone at the expense of all the other hormones in the body. And so when we remove that inflammation and start to help the body adapt to stress easier, it allows the body to produce hormones more efficiently like it should. I want to give another nuance here because I think it's extremely important. Oftentimes people think that maybe they just need one test to do, right? And for most people, for many people, we hope that's the case. However, when we look at a house that needs to be repaired, there's different rooms in that house, right? And so oftentimes, we'll start in one area, but we'll have to do testing in other areas as we go to see what we need to do, right? To see what we need to do to help you. So you had this lady, chronic constipation, fatigue, heartburn, weight gain, right? Also had a history of breast cancer, basically for about 15 years after she had breast cancer. And her main goal was to lose weight and get her energy levels back again, okay? And she also had a lot of heartburn she was dealing with, using different home remedies for that, constipation, using magnesium. And so basically what happened was we were able to help her to lose a bunch of weight, right? She was able to get her energy levels up. Her digestive system was very much way better. So we were able to achieve her goals of what she was originally there for. But then I had to have a conversation with her about, hey, what about, this history of breast cancer? We should probably look at your estrogens and see what they're doing in the body because it was an estrogen-based cancer. And so we did some further digging, and guess what? Her estrogen levels were sky high. What does that mean? Her liver wasn't moving that estrogen out, which was making her, again, very, very, very prone to that cancer returning. So even though she went through chemo and all these different cancer therapies and her cancer was in remission, she was a ticking time bomb. Her body was still sick. And so that's one of the things that we always say is cancer doesn't make you sick. Being sick over time will lead to cancer. So meaning the body living in dysfunction day in and day out will end up with cancer. And so we really had to work on helping her liver to process out all this different extra estrogen and help to keep those liver pathways open and free was the solution for her, which is going to drastically decrease her likelihood of ever developing cancer. So the next case I want to get into is this sweet little 8-year-old, chronic allergies, severe asthma, allergies, pretty much sick monthly her entire life at 8 years old, going from steroids back to antibiotics. Basically, she had, over the last 2 years, she had 2 full pages of all the prescriptions she'd had over the last couple of years. No digestive problems whatsoever, but I knew that we had to look at what's harming her immune system. So we did 2 things. I did a chiropractic evaluation, and then we did food allergy testing and stool testing so we could look at what's going on in her digestive system. And what we found, obviously she had food allergies we needed to stay away from. She had major problems in her neck as well as her upper back. Both of those areas have profound implications on how the lungs are able to expand and contract. She was markedly better even just starting with chiropractic care. And then once we got the lab testing back, what we found was that number one, she had a massive amount of inflammation in her digestive tract, and she had markers that would indicate that she had a chronic inflammatory disease like irritable bowel disease or Crohn's disease, even though she didn't have any pain in her stomach. And I knew that this is one of those 2 areas that we needed to address. And so we got her on the proper nutrition. Again, I hate to tell you this, but she was not 100% with her foods. She did really good, but again, with the extra support for nutrients and the extra chiropractic care, it increased the adaptability and immune resilience. And essentially, after a month of care, she was not on any antibiotics ever since, number one. Number two, her asthma, her allergies, all that stuff was pretty much resolved. And her follow-up stool testing, we actually were able to put those different markers, basically get them to where they're pretty much in normal levels, which essentially could tell us that, hey, we're actually helping her to prevent the development of irritable bowel disease later in life. Okay, so this stuff, again, is profound. When we look at immune system problems or autoimmune problems, we had a 52-year-old lady, right? This is a great example of that sort of thing where she had a diagnosis of Hashimoto's disease, which is a thyroid autoimmune problem. We did stool testing, and what we found was a massive amount of inflammation. And again, those signs of Crohn's disease, irritable bowel disease, and essentially by helping to get her off of those foods and healing up her gut, we were able to resolve the bloating, the fatigue, the reflux, the asthma, the chronic diarrhea, the anxiety, and help to decrease those autoimmune markers. The sad part about this one is that she chose to go back to her old lifestyle about a year in and became extremely sick after that again. And so unfortunately, the changes did not hold up long term for her. And so one of the things that I want to mention about this lady, again, she came in on heartburn medication. Heartburn medication or GERD medication, these are one of those things that can create a lot of problems down the road. In fact, the technical term proton pump inhibitors are correlated with everything from deadly intestinal infections, autoimmune disorders, osteoporosis, B12 deficiencies, which can lead to fatigue, that sort of thing, as well as other problems as well. Gastric cancers, chronic kidney disease, and a 30% increase in heart problems, and then also depression. So you guys, and here's the thing, and the reason is because your body needs to be able to break down food and digest it. And so this is one of those examples where, yes, do heartburn medications take away heartburn? For a lot of people, they help, but most cases of heartburn are actually a lack of gastric acid production. And then what happens is when there's not enough acidity in the stomach, the foods that we eat don't get broken down, the proteins don't get digested, and so those proteins sit in the stomach and they get putrid and they start to create a bunch of bloating and gas and heartburn and start to come back up. That's why a lot of that heartburn always happens 2 or 3 hours after eating food. It's kind of like putting a steak in a Ziploc bag and putting it out in a 100-degree day and watching it start to, essentially get putrid. That and your stomach should work as a septic tank or a decontamination tank where it kills off, a decontamination tank, where it's supposed to kill off bad bacteria that shouldn't be in there. If we're using proton pump inhibitors that inhibit your body's ability to produce acid, those different bacteria and viruses don't get killed off, and it can end up actually causing infections down the road. The list goes on, but I bring that up because this particular patient was on those medications. That was one of the big reasons that she was so sick. The next thing I want to talk about is when it comes to diabetes, insulin resistance, and weight gain. You guys, this is a hormone problem and an inflammation problem. And what I want to get into here is most people have never had complete or accurate testing done. This is one of my big pet peeves in this world, is because very often the very treatments that they give to supposedly help with diabetes actually makes diabetes worse with time. This guy, this is a great example, right? So he had a normal blood glucose level. However, when we actually did his testing for insulin, so insulin is the hormone that's supposed to take your sugar and move it out of your cells and put it into other tissues and to help you to regulate normal blood sugar levels. What happens with diabetics, because of what happens inside the human body, the pancreas has to make more and more insulin. Well, insulin, in order to keep those blood sugars normal, insulin is a fat storage hormone, meaning it triggers weight gain, okay? This gentleman, so a normal fasting insulin should be from about 2 to about 6. And this, you guys, if you're not having your insulin levels checked, even if you're not a diabetic, right? Everybody should have their hemoglobin A1C as well as their insulin levels checked, as well as checking for signs of inflammation and things like that, which is a whole nother topic. But this gentleman was extremely sick, okay? He had a massive amount of inflammation going on. Vitamin D levels were dangerously low. His iron levels were dangerously high. And you guys, this all goes in together. And this is one of the things that we really work on reversing, because if we can reverse that insulin resistance where the pancreas is having to make so much extra insulin, if we can reverse that, the person's not only going to lose a bunch of weight and feel really good, but we can actually start to reverse diabetes itself. Okay. What's also important about that is that's the first stage when insulin levels start to go up, but our blood sugars don't. So we may not even know that this is developing inside of us, but there's also typically damage happening because of those elevated insulin levels. Next thing that happens is it's not until the pancreas either wears out or it gets too fatigued to produce insulin, or it just can't keep up anymore, that our blood sugars actually start to rise, and then we get a diagnosis of diabetes. And then what the typical approach is to put you on more insulin. Well, what's going to happen then? You're going to worsen that insulin resistance, number one, but number two, you're actually going to start to put on weight, and you're not ever addressing the underlying problem. Yes, that insulin is going to bring your blood sugars down to save your life for the short term, but there's a massive amount of long-term implications from it itself. Our perspective is, hey, let's reverse the insulin resistance, get you off your medications, keep those blood sugars normal, teach you how to do that so you can get the weight off, but also get your heart healthy and ultimately live a normal life instead of having all the long-term implications of being a diabetic. Because even well-controlled medically, diabetics also have a high rate of all the problems that go with it, including peripheral neuropathy, okay? Including, amputation of limbs, including loss of vision, loss of kidney function. The list goes on and on. If you're only addressing the problem through medication, I can tell you those things are still very likely to happen. This is one example. This gentleman came in 7 different prescription medications: migraine headaches, type 2 diabetic, joint pain, inflammation, high blood pressure. If you look at his labs in May of 2019, this is with that medication, okay? All the red, that's all bad news in through there. By September of 2019, he was completely medication free. Still had some work to do with his CRP, which is a level of inflammation. But again, as you can see, as he continued to work at it, next thing you know, those numbers are actually looking very phenomenal. This gentleman he also dropped about 90 pounds. You'll see his body fat composition testing that we use is one of our tools to see how the body's progressing. Dropped a ton of weight, went from 270 pounds down to about 200. And body fat percentage went from about 36 down to about 24, which is right where he should be. This gentleman, even though he loved golfing, had completely quit golfing because of the migraine headaches. We got him under some good quality chiropractic care. He was under care somewhere else, but wasn't getting results. Got him under good chiropractic care, started correcting those subluxations and correcting those different problems. And so ultimately was able to get off all his medications. Went from being on all 7 of those to within a year being off all of it and having really good labs, feeling great. He actually went and got a job at the golf course because he's feeling so good so he could golf every day. And that is why we do what we do. As we're going to talk about diabetes, there is a complete other class on diabetes. If that's your main concern, go ahead and feel free to skip over to that and watch that one too. And then peripheral, or if you don't have access to it, text message the clinic or send us an email and we'll get that video sent out to you as well. Peripheral neuropathy, okay? This is another major issue today, especially what we're seeing is that there is over 100 different triggers. And this is another situation where we have a full in-length class on peripheral neuropathy itself. But you guys, this is nothing to scoff at. And unfortunately, the medical approach is not working. The idea that we can just medicate it to numb the pain and help you to just not feel the health and the life of your legs, it basically continues to die. They call it medicate until you amputate. Your tissues need blood flow, they need oxygen, and they need nerve flow in order to heal and in order to maintain function, okay? Type 2 diabetes is the #1 trigger, but there's over 100 different triggers. Our approach is to actually restore as much blood flow and circulation and help those nerves to heal as much as we can. So that way we're slow stopping and even sometimes reversing the disease process. Most people, if we find we can help, most people are going to see anywhere from a 30 to a 95% improvement in their peripheral neuropathy symptoms. And again, we're not just numbing things, right? Most of these medications are geared just to numb it so you don't feel the process happening in your body, where our job is to actually restore as much function as that carpenter as we can. And then to help to remove those underlying triggers, whether it's diabetes or whatever that happens to be, to help you through lifestyle to restore that and to restore the health of your cardiovascular system. Male hormones, testosterone production. Okay, this is a great example. 40-year-old male, very much low testosterone levels. Even though he was active, he's working out, but he dealt with some extreme fatigue, brain fog, depression, trouble sleeping, neck pain, low back pain. The big things that we look at when it comes to testosterone production, right? #1, do we have blood flow to the testicles? Okay. And I mean by that is you need good, healthy blood vessel tissue, right? #1 and #2 are there different medications that are interfering with blood flow to the testicles. And that way, that blood flow can carry the nutrients that the testicles need to produce testosterone. Do we have the right upstream hormones to produce testosterone? So getting other hormones like DHEA checked to make sure that we even can produce the right nutrients. And then the other thing is, are we turning testosterone into estrogen at too high of a rate? And this is a big thing that we see. If you're insulin resistant, right? If you have blood sugar problems, or even if your blood sugars are normal, but your insulin levels are high, you're very much likely to be converting testosterone into estrogen, which is going to lower testosterone levels. And then also if you have problems with your liver and we have a bunch of liver congestion, there's a lot of conversion and things that happen in the liver in order for testosterone to be produced. So what our approach is to say, hey, we're not going to give you a bunch of extra hormone or anything like that. we are going to help your body to restore testosterone production to normal on its own. And so this gentleman was able to go from a 248 to a 421. We do like to see that over 500, but again, that was just within a few months of work. And so we continue to work on that till we get it to where it should be. In order to understand how for women, right? And this is, when we look at what a normal hormone pathway should look like, there is going to be changes in emotion throughout the month. That's normal. That should happen, you guys. And so knowing what it is and being able to handle that appropriately is always really important. There's hormone changes throughout the month because your body is preparing to conceive a child every month, right? Being prepared for that. And then it has to start that cycle all over again. So different hormone issues, things like PCOS, infertility, things like that are all things that we generally want to look at. So what is PCOS, right? PCOS very often is a blood sugar issue or liver issue or a hormone pathway issue. And so that's where when we look at the testing, without accurate testing or thorough testing, it's going to be really hard to resolve that PCOS. And this is, again, one thing our team is really great at helping with. Autoimmune problems. So thyroid, right? So thyroid health, okay? This is a big thing, you guys. This is an example of a lady that had come in and she had primarily had her T3, her T4, her free T3, her free T4, and her TSH levels ever checked. She was on levothyroxine, but she was still having massive amount of brain fog, fertility problems, endometriosis, depression, anxiety, the list goes on. And so we did thorough testing to look more in depth at what was happening. And I want to give this just as an example. She had a massive autoimmune problem going on, meaning her immune system was seeing her thyroid as a bad actor, and it was going there and putting a ton of stress on it by actually trying to clean up dirty tissue in through there. And so whenever we're looking at a thyroid problem is very rarely and actually just a thyroid problem. Okay, so we look at 4 things. Are we producing enough thyroid hormones? And if we're not, what does the body need to actually produce it? Do we have enough iodine, right? Do we have the right nutrients to produce thyroid hormone? Are we converting it? You guys, most conversion does not happen in the thyroid itself. A conversion problem is usually a liver, kidney, or digestive tract problem because that's where most conversion actually happens. And so without getting good, thorough testing, it's impossible to know where to actually start and so to actually help this person. Interference, right? So is there any interference when it comes to chemicals or stress, right? So we look at things like your reverse T3, where essentially we'll shut down that thyroid conversion into T3. Are there things interfering with how that thyroid hormone is working? Inflammation can interfere at the cellular level in your body's ability to actually use thyroid hormone that you are producing. And then destruction. Is there tissue destruction? Is there an autoimmune process in that case or going on in that person? And so when we know what type of thyroid problem it is, oftentimes we're able to get you off that medication because most of the time the medication can manipulate your numbers to make them look good, but you still don't feel healthy on the inside. You still have the massive fatigue, the brain fog, all these things that this lady was going through with. That's where that thyroid particularly comes in looking more in depth. And then autoimmune problems, right? And so different triggers of autoimmune issues. If a person's been told, oftentimes we'll have people that are told that they have an autoimmune problem, but they've never really been helped to figure out what's triggering that autoimmune problem itself. And so this is where there's over 100 known different autoimmune diagnoses, but what it is essentially, if you think about your immune system like a wash machine, right? Its job is to wash and get rid of things that shouldn't be there, viruses, bacteria, cancer cells, right? The broken down tissue, right? To eat that up and get rid of it. And so it works, kind of like a wash machine, right? And so the question is why is that wash machine keep trying to wash that thyroid or wash that different part of the body that has the autoimmune problem? And why does it keep going after it? Well, it's because the different triggers, whether it's food allergies, whether it's infections, they keep making that tissue look dirty to the immune system. And so the immune system's job is just doing the best what it knows what to do. But oftentimes people will end up being put on different autoimmune drugs with massive side effects. And so instead of actually addressing why that laundry keeps getting dirty, right, it just shuts down the wash machine, right, and doesn't allow it and stops allowing it to do what it should be doing. The immune system's job is to protect you, right? And so then that's why a lot of the side effects of these medications are, things like cancer and things like that, because of how it affects the immune response. I don't subscribe to the idea that sometimes the immune system makes mistakes, right? It's doing the best it knows with what it's doing, right? But the reason that it acts up like the way it does is because the diseased tissue needs to get cleaned up and is doing what it needs to be doing. Which brings up a whole another idea here, is that, when they say there's nothing that can be done, find a different doctor, you guys. This is the whole thing, right? When they say nothing can be done, what they mean is that there's nothing that they know what to do. Meaning there's no axes or fire hoses that can help resolve the problem. But very oftentimes finding the right carpenter and getting those answers can find that solution for you. So if you're ever told that, find a different practitioner, find a different style or type of practitioner. If I ever tell you that there's nothing that can be done, I would say find a new practitioner, okay? And the reason I say it is I don't say that. I will say that there's nothing that I know what to do or that I don't have that solution, and then I'll try to find you somebody that does. 25% people with autoimmune problems will develop more autoimmune problems as they go through life. This is also an extremely important thing to understand. And the reason that is because if you're not addressing the underlying problem, it makes sense that dirty tissue is going to go to other dirty tissue and your immune system is going to see a problem there too. So things like rheumatoid arthritis or like Hashimoto's or Crohn's disease, right? All these things are autoimmune problems, even celiac disease, right? And the one learning mechanism, the learning idea of to say, hey, celiac is an autoimmune disease, but we've all heard it, it's very popular now, right? But what makes that go away? You remove the triggers, you remove the gluten that causes the celiac to happen, or the immune system process to happen, so that tissue stops getting polluted with gluten and the problem can go into remission. This is how autoimmune problems work. The problem is it's like celiac is the only one that they'll actually admit that it's environmentally triggered. And so when we look at the other immune system problems, the other autoimmune problems the same way. What's triggering that immune response? And I can tell you there's rarely ever just one. It's usually multiple. So different toxins, right? So when we talk about different heavy metals, cosmetics, you guys, by the time the average woman leaves her bathroom in the morning, she has over 289 chemicals on her. The average child born has over 200 chemicals in their system when they leave the womb. We live in a toxic, super toxic environment. There's no way we can get rid of all the toxicity that we face. And that's where I think, the perspective of let's remove what we can to decrease stress on the body, and then trust that our innate immune system that God put into us can handle what pollutants that we're exposed to, provided those pollutants don't overwhelm our body's ability to deal with them. So the less we can expose them to, the better off we are long term. Key ingredients to avoid. I'm not going to go into all these personally. Hit pause if you want to take notes. Hit it later. You guys, these are all things that will get you way ahead. If you want to start getting rid of these things like your seed oils, your processed sugars, right? Your trans fats, the list goes on and on. Go ahead and start into that. Start reading labels, you guys. And this is part of any sort of health journey, is you're going to have to know what's in the foods that you're eating. If you can buy it local, right? My friends out at Nourished by Nature, they have, your eggs, your chickens, your lamb, like a lot of really great foods, your honey, your maple syrup, a lot of really great foods produced regeneratively without any sort of toxins, right? If you can buy your fruits and vegetables local. But if you look at even like this Nutri-Grain bar, right? We're told that this stuff is healthy, but there is hardly anything that's actually good for you in that entire list. I used to eat those things like crazy because they're marketed, they look nutritious, you guys. And so this is where get smart, start reading labels, right? The more ingredients, the better off, or the worse off, excuse me. The next component I want to talk about are our thoughts, right? So thoughts, traumas, and toxins. Emotional stress plays a massive role in how the body works. This little lady here, 57-year-old woman with joint pain, fatigue, diarrhea, asthma, elevated blood sugar levels. If we look at her adrenal reserves, they are really tired, right? So that DHEA is really low, which means that she's been under a lot of stress for a long time. That's going to deplete her hormones. Generally speaking, stress affects women more than it affects men. And this is one of the things that we always talk about as a chiropractic clinic. Having a healthy spine and a healthy nervous system plays a massive role on your body's ability to handle stress. There's also a lot of great different things to remove those stressors, right? Things like meditation, things like prayer, right? Having faith, having a social life. These are all things that are extremely important. And so when we look at that, we want to make sure that you are taking care of the stress in your life. Now, the next thing I want to get into here, when we talk about this, you guys, I gave some examples of some of the different lab testing that we do, just to maybe give you an understanding of how deep and what we actually look to do to help you. And I hope I was able to shift your thought processes on how to approach diseases and chronic diseases today. Whether you're dealing with a chronic knee problem that needs to be restored, we just need to restore function of that knee, whether it's your spine, whether it's your hormones, whether it's your digestive tract, whether it's diabetes, no matter it is, right? We talk about this, right? Is there something more valuable than our health? Sometimes people will say, well, my daughter's health or our children's health. And yes, I will agree if that's where you put that. And I will also say, if you don't help yourself, how can you help them, right? You can't give from an empty cup. What I also know is that people are willing to spend anywhere from $20 to $50 to $100,000 on a home remodel without blinking an eye, right? Where we expect to spend money on our house, but we get really stingy when it comes to spending money on our own health. And you guys, this is the only house that you get. You don't get another one. You can't go and trade it off. Insurance is going to pay to rebuild it if you let it burn down. And the other thing is, the earlier and the more often that you can contribute to your health bank account, right? Meaning the more you can invest in your health early and often, the better it's going to be down the road. And it seems like we devalue disease a lot more in our world today, meaning we tend to not want to do anything about our health until we actually already have a disease diagnosis. And then we realize we got to change. But oftentimes the route that we're taught to go down isn't maybe the best route. The other question we get a lot is, what about cost? What is this going to cost? And will my insurance cover it? Here's the thing, you guys. Medicare, by their very own admission, does not pay for, number one, chiropractic maintenance, right? They consider it not medically reasonable or necessary and is not payable under the Medicare program. Maintenance therapy, including services that seek to prevent disease, promote health, and prolong and enhance the quality of life or maintain or prevent deterioration of a chronic condition. They do not cover to get you healthy. They don't cover to prevent disease. And this is where, you guys, this drives me nuts. It shouldn't be named Medicare. It should be named Meta I don't care, right? Because they don't care about your health. They don't care about preventing disease, okay? And so unfortunately, any of our health, food, and nutrition services are not covered under insurance. Oftentimes you can use your HSA or flex spending and things like that. And so definitely bring that. We'll use the whole thing if we can, right? And put it all towards getting your body healthy again. And hopefully we can keep you out of that sick care system. That's the goal, is to help you to stay out of that system that's not working. And that's the thing, you guys. For most people, insurance doesn't work to get you healthy. And so that's why most people are in the situation that they are today, because they only rely upon what insurance covers. So I always tell people, they say, well, what is this going to cost me to come in? You guys, I have no idea until we know what we need to do. It could be anywhere from a child that's a pretty simple fix of, $800, $1,500, depending on what we need to do, to somebody that's got 70 years of chronic disease that we need to work on structural stuff. We need to work on home care. We need to do things in the office. We need food and nutrition. We need extra testing. And that can take 2 years to get you from sick to healthy. And that could be upwards of anywhere from $5,000 to $20,000. We don't really know. Obviously, I don't think I've had a case that high before, but I'm not saying that over a 2-year period, if they're sick enough, that they're not going to need that. So it's all dependent upon, number one, what we need to do. Number two, how diligently that you follow through with what we ask you to do, right? That's the more diligent you are, the more quickly we're going to achieve our health goals, and just how long we let that process, and how long that disease process has been going on. So what I don't want for you is to say, in another 2 years, like my grandma said, that I wish I would have taken better care of myself before it was too late. So I truly want to invite you to come into the office. If you've already listened to this, right? Obviously that first appointment is $175 for you. Normally it's up to $350. It's a consultation, review of past test results. So if you have them, if you feel they're relevant, give them to us. If not, that's okay too. Full-on exam if needed, right? If we're not doing chiropractic in the office, a lot of people, they do remote work, or like if they're 3-4 hours away, we do stuff over Zoom or over the phone, or if it's just too far to travel for any sort of corrective chiropractic care, we'll try to find you somebody local to do that. If you are close enough, we do that 4-view motion x-ray if needed, so we can see what's moving and what's not moving. And then those initial next steps, which means get you on essentially some basic food changes, get you started down that direction, get your lab tests set up. Does not include the cost of the labs, and some initial supplementation if we believe that, if there's some heartburn, things like that, we want to start getting that corrected immediately. We get you going with some of that stuff right away. Again, what this is to figure out where we need to go to get you started testing. And then after we know what we need to do, we follow up and we take you through all of it. Okay. We take you through your lab tests at a separate appointment. We take you through your x-rays and your chiropractic evaluation, go through what's working, what's not working, and most importantly, what we need to do to correct that underlying problem. So our first job at this first visit, when you come in, I want you to set up an appointment if you haven't already. So if you've already made your appointment, great. Start thinking about those goals. Start thinking about what kind of, guessing what sort of test I'm going to pick, or any of our other healthcare practitioners are going to pick for you based upon what you got going on. Think about your goals. What do you want things to look like in 5 or 10 years? What can't you do now that you want to be able to do? Start dreaming of a better future, right? Start dreaming of what would life look like if I could get the 50 pounds off, if I get my energy levels back, right? If I could get this knee fixed, right? If I could get this neuropathy reversed, right? If I could fix this PCOS, what would that do for you? Because that's ultimately going to help to drive you and help you to be successful in reaching your goal, because it is work. It is work to change. If you haven't made an appointment yet, call the office, email the office, text message the office, and get that appointment set up. If you're listening to this and you're like, I don't think this is for me, obviously, like that's okay too. If this isn't the route that you feel like you should be going down, we'd rather know that before you get into the office. And also, serious takers only. We don't want people that come in and don't really know what they want or aren't really sure whether they're ready to make a change or not, because we value your time, we value our time as well. And lastly, share this video. Like if there's people in your life that need help, or you think maybe even may need help, or hey, this is phenomenal, right? This is something that's really cool. I think you should listen to it. Pass it on. You guys, the worst case scenario, they don't watch it, right? Best case scenario, they see it and they realize that there is a different form of healthcare that I cannot tell you how many times people have been saying, I wish I'd have known about this earlier. We've been looking for healthcare like this. So I want to thank you for listening. Thank you for taking the time. I know it's a long video, and looking forward to seeing you in the office soon. Thank you and have a great day.